It's very imperative that we all have some knowledge about the most common medical conditions in elderly so that we are more prepared to deal with them if diagnosed. This includes understanding the condition itself, the treatment available, ways in which to prevent the condition, and how to live with it. Good morning, everyone. We have with us today Dr. Sadhana, family medicine physician at the Apollo Heart Center, Chennai. Dr. Sadhana is an MBBS, MRCGP UK, and is trained in family medicine in UK. Dr. Sadhana has over 18 years of experience in family medicine and special interest in geriatrics. Good morning, doctor. Good morning. Very happy to have with us today. Who is a family medicine physician, doctor?
Before we start off to talk about who's a family physician, I would like to tell you about a little bit about the health. If you look at the WHO guidelines or the definition of the health, it is a state of physical, mental, and social well-being rather than just mere absence of the disease. So, a family physician is a person or a doctor who looks after all these three, the physical, mental, and the social well being of the patient. We are not dealing with just diseases alone, we are treating the patient as a whole with respect to his social and occupational problems.
Okay. What are the common problems that we see in our geriatric population today?
There are several problems that we see in geriatric patients from time to time. Most of the commonest ones, which I would say, is diabetes and hypertension, and which most of them develop by the time they are 50 years of age. And the complications of these two diseases, plus obesity, they just tend to develop when they are 60 and 65 and above. The most notorious of the ones which are the cardiovascular diseases, which is the heart problem, and the stroke, which is related to your, we call it as a brain attack, just like your heart attack, and obesity related problems like cancers and other problems related to obesity.
There are two components in geriatric medicine, doctor. One is the curative component. The other is the comfort or the palliative component. Can you please share some insights on what they are?
The treatment of geriatric patients is not going to be straightforward. There are a lot of problems which we can cure, which we can keep it under control, like diabetes, for example. But there are a lot of other problems which we can only keep the patient in comfort and make the patient live according to their sort of disabilities or not able to live up to their efficient quality of life. So, for example, like take for example the arthritis. Many geriatric patients suffer from arthritis of their knee and their hip and neck, and we tell the patients as to how to live with the pain or how to manage the pain and how to live with their day-to-day activities. How do they go about it? How physiotherapy would help them? How sort of other alternative management will also help them. So these are all the sort of the curative part of it, the comfort part of it, rather than the curative. So which needs to be addressed is very important. Obviously, because we are a geriatric population, we need to take hold of both this into consideration and treat them. It's not going to be straightforward as we treat the adults.
Okay, we have a question. Summers have started, tell us a little bit about the care that has to be taken in elderly patients when it comes to sunstroke or managing the heat.
Yeah, I would definitely advise elderly people to stay indoors during the peak summer, during the peak sunny time, which is between 11 to 4 o'clock, because they do tend to go into absolute dehydration and sunstroke and collapse. We do tend to see from time to time to the patients presenting to emergency with a state of collapse and dehydration. So drink plenty of water, which is very, very important, almost twice the amount of water that what you were taking during the January and December, and eat plenty of fresh fruits and vegetables. That is very important as well, because people do tend to eat something stored in the fridge for a couple of days and things like that, and that would give them some sort of a stomach upset, which is not advisable. So eat plenty of fresh fruits and fresh vegetables.
Thank you, doctor. We have a question. My mother is aged 72 and is suffering from arthritis for the last 5 years and has undergone many treatments but still not cured. Please tell me how to cure her disease, doctor.
Yes, as I have told before, arthritis is a major problem in elderly population. So, what I would advise is consult your local doctor, see what incapacity she has regarding the arthritis, and what sort of management plan you could come up with. Is it just the painkillers or topical painkillers that she would be comfortable with? Does she need physiotherapy, or how bad is it? If she's 70 and if she's living a good quality of life, and if arthritis is the only thing that is limiting her, I would definitely advise her to consult an ortho specialist and have a knee replacement done. The life expectancy in India has gone up to 80 years these days. So for another 10 years, she shouldn't be living with pain and limiting the quality of her life. So this is something that people don't understand, that they think elderly people, oh, it's the knee pain and they have to put up with it. No, you don't need to put up with it. If you do have a decent quality of life, you could go ahead and have a knee replacement done.
Uh, Talking about knee replacement and surgery, tell us a little bit about medicine management in elderly people today.
Yeah. You rightly asked this question because in this population there are number of medications that the elderly people take. Most of them have diabetes and hypertension and a heart problem, and as you said, arthritis. So if you look at a medication list of any elderly people, they have about at least 6 to 7, and they tend to see different specialists, and each specialist adds on to one medication. So what I would say is, please see your family physician or your family doctor every 3 months. Get your medication reviewed every 3 months to 6 months, and we see most of the patients who are taking tablets without knowing for what they are taking. And some of them cause quite a lot of side effects, especially if you're on 3 or 4 antihypertensives. They could cause very low blood pressure, and they tend to fall because of that. And people who are on insulin and a lot of oral diabetic agents, they also tend to fall down. Once these people fall down, they tend to get fractures. So medication review is something really important, and they need to get it reviewed every 3 to 6 months time.
And can it also be that every time there is a medication change in their reviews or visits,
Yes,
or
of course. Yes.
if there's some chronic condition that crops up in between,
Yes.
they have to check through the entire list and see whether whatever they're having right now is suitable or not?
Yes, of course, that is very important. As we discussed before, because the family physician or the family doctor would be a better person to consult and have it reviewed, because a specialist, they are quite busy, they don't have the time to do the medication review. So some of them might even think, no, it is the other specialist tablet and I'm not going to interfere with it. And so a trained family physician would be able to understand the patient, her own social aspects, and what sort of mobility she's got, and does she really need 3 or 4 tablets, and she analyzes everything and does the medication review then.
Talking of medicine management, chronic diseases are something that crops up in elderly people very often these days. Can you tell us a little bit more about what are the chronic diseases that are affecting elders today, and how do we manage it?
As we discussed before, diabetes and hypertension are two major diseases, chronic diseases that affect the elderly population. Obesity is also another problem that we tend to see these days in most of the elderly people. And heart diseases, we call it as a coronary artery disease, and by the time you're 60 or 65, at least 60% of them some heart related problems. That they might develop either a heart attack or an irregular heart rhythm, or whatever it is really related to the heart. And the other thing is your stroke, which we discussed about, and incapacity because of the stroke. You're not able to walk, you're not able to do your normal activities, you're not able to speak. So these are some of the chronic diseases that affects the elderly population. And Because their mobility has gone down, because their nutrition has gone down, because their metabolic rate has gone down, this particular group of population is quite vulnerable to these sort of diseases.
Thank you, doctor. Talking of chronic diseases and its management, depression is one such disease or condition that most of the elders today are facing. In fact, the younger population too. So, can you tell us a little bit more about it?
Yeah, depression is one major health issue. We don't tell it as a chronic disease, but we call it as a major mental health issue. As you rightly said, it does affect quite a lot of elderly population because the family has grown and the children are not there with them, and they don't know. Especially in India, the concept is that you basically live for the children, and then when they start working and they get married and they move to another city or a country, you feel left out of the whole sort of situation of your children's lives. Obviously the children have moved on, and then they come to a sudden sort of a vacuum. What have I been doing all these days, and I don't have anything else to do, because all this time they've been focusing only on the children's needs, not taking care of themselves. So it is very important that they take care about their own mental health issues. They have to live for themselves. A lot of studies have showing interest in new hobbies, taking up a new game, whatever their mobility or their physical ability allows them to do. Socialize with your own friends and whoever family is left, and trying to work as much as you can. These are all the problems, these are all the solutions that would help keep depression at bay. Depression is something that if you're not talking to people, you're just bottling it up inside, and you're just coming out at some particular point saying that I'm not interested in surroundings, I'm not interested in getting ready, I'm not interested in socializing, and you feel low all the time, and you start to cry. And especially in geriatric population, it is very difficult to identify, to diagnose, and we should be ready to identify what it is, and the patient should be ready to accept, yes, I'm facing depression, and they need to start taking medications or have behavioral therapy. The problem in India is depression is sort of a stigma to most of the most of the societies. We think depression is something that happens to every other person, not to themselves. Even as you rightly said, in adult population also, these days we are seeing quite a lot of depression. But it's very important that they get identified quite early, get diagnosed quite early, and go on the right treatment plan with either the medication or with the behavioral therapy. And again, a family physician, with the other family physician that is here, who is here, we do tend to counsel quite a lot regarding these patients.
Okay. We have a question, doctor. Are disturbed bowel movements common in old age?
Yes, disturbed bowel movements is very common because you tend to eat little when you grow old, and you do tend to have either constipation because you are not eating the right amount of quantity which is required for your day-to-day life, or you're not drinking enough water, which again leads to constipation. You're not eating fruits and vegetables, that again leads to constipation. Or the other thing is your diarrhea, which also sets in. Now the diarrhea needs to be seen again by the doctor, whoever is there, the family doctor. Rule out most important causes, because colon cancer is very common in the elderly age group. So they need to make sure it is not a cancer or any other inflammatory bowel conditions or diverticulitis, and then get treated for whatever it is for. The other thing which is very common is irritable bowel syndrome. Again, as you grow older, a lot of people tend to have this irritable bowel syndrome. Like if you eat something, you want to go to the toilet immediately, you have abdominal cramps. So for all these conditions, you need to consult your family doctor or your physician and get it treated.
Thank you, doctor. We have a question. Hi, doctor. How do we address sleep problems in elders?
Okay, the sleep problem is very common in the elderly age group, primarily because they tend to sleep quite early in the night. Their physical ability allows them to function up until 6 or 7 o'clock, and they want to go to bed early. So when they go to bed early, they wake up early in the morning as well. So normally they wake up around 3 o'clock or 4 o'clock, and then they really don't know what to do with their time because the rest of the family is sleeping. The other issue, that is one type of sleep problem. The other issue is some of them tend to, because it's like a cycle. So if you wake up at 3 or 4 o'clock, you tend to snooze around in the afternoon as well, and then you do not sleep in the night. Okay, so that sort of a thing will go on. The other issue is that the mind is quite active as you grow older. So when you keep thinking about something or the other, with regards to any of your family members, or with regards to your work, or with regards to your physical illness, like when we talked about depression, then you don't get sleep as well. You need to be, again, seeing your family physician or a doctor. And people, when you see elderly age group, most of them are on sleeping tablets. What I would suggest is try not to go on sleeping tablets. If you can, go for an evening walk, take some books to read, and read it until 9 or 10 o'clock, and then have a glass of milk before you go to bed, and then go to sleep. And it's okay if they wake up at 5 o'clock, or and then carry on with their day-to-day activities.
Sometime back we spoke about elders having the risk of having injuries during a fall, or tremors, or lack of balance. How do we manage it? How do we identify it? How do we treat it in elders?
As we have discussed about it before, tremors is slightly a different problem, because the tremors is something that we need to have it looked by a neurologist. If it is going to be a resting tremor, like when you're sitting down and your hands are trembling, or if you're having a slow walk, and if you're not having expressions on your face, then that's a condition called Parkinson's, and that needs to be consulted by a neurologist to find out what exactly it is and what treatment they need to go on. That is one sort of a tremor. The other tremor, we call it as intentional tremor, which sometimes people will have it in their hereditary thing, when they try to pick up a piece of cup or whatever, they have this intentional tremors. So that is sort of a benign thing, and you don't need to worry too much about it. But the history of falls is very important here. As we've discussed before, the history of falls is very, very common in this age group, and it could be due to a number of reasons. It could be because of high blood pressure, low blood pressure, your low sugar levels because you're taking insulin, because of your medications. That could be the problem. It could be because of an arrhythmia, which is a irregular heart rhythm. It could be because of your electrolyte disturbance, because you're taking too many medications. If you have a low sodium or a potassium, and then you don't know what it is happening, and then you fall down. It could be also vertigo. So we're dealing with numerous causes for patient who's falling down. So we need to exclude everything and then come to why this patient is falling. Now, with regards to the falls, so the elderly patient should make sure that their surroundings where they're living in should be safe, which is very important. We see many patients living their own lifestyle when they were 50s and 40s. They still live in the first or second floor. They still want to climb up and down the stairs. Staying on the ground floor would be an ideal option, so that you don't climb or up the stairs and you have a fall. You make sure you have railings fitted around your house so that you don't fall. Don't have a slippery bathroom, which is very important. And even if you, there are a lot of tiles which has come, which is sort of non-slippery. So you need to change or adapt your home surroundings according to your age. But we don't see that with elderly population at all. So that's very, very important to take into consideration. And that's where in abroad, we used to have something called an occupational health, where we ask them to go and assess their home surroundings and suggest, okay, they need a railing here, they need a handle there, like when they sit in the bathroom and then they want to get up and there's nothing to get hold of, and they get up and then they feel faint and they fall down. All these sort of small, they're all very small things, but it's very important.
Thank you, doctor. We have a question. Is glaucoma more common in older people?
It is quite common in elderly people. It can come in adult population as well, but we also see it in the older age group. Obviously, it is because of increased intraocular pressure, as most of us will be knowing about it, in the eye. And sometimes it is hereditary. It usually presents with blurring of vision, headache, and not able to focus on things, but glaucoma is an important condition which needs to be seen by an ophthalmologist and get it treated. If you know you have a history of glaucoma, you need to have a regular review with your eye doctor. It is very important.
Thank you, doctor. My grandmother is paralyzed for a year now, and recently she has started developing bed sores. Is there a way to treat it?
It is very difficult to treat bed sores, especially when the patient has had a stroke, or we call it as this paralysis, and they're bedridden. Again, we don't have a concept of this occupational health in India, but this is how it is. You need to have a sort of an air bed where they don't have that much of pressure on their skin. You need to have a proper nurse at home if you're taking care of her at home, and you need to keep changing the position of the patient very frequently, so that they're not staying in one particular place and develop this sort of bed sore. And the other, quite common, the bed sores do develop in the sort of in the lower areas, because you tend to either leak urine or feces, and that gets stagnant and you develop an infection because of that as well. So all of these needs to be taken care of. Having a good nurse who would be looking at all these sort of problems would be very ideal. But if you are taking care of your own grandmother, you need to take into all these conditions. If she's able to sit up, then I would encourage her to get her on the chair and then get on the bed, and make sure she's not putting pressure on all these sort of sitting areas, and that sort of a thing.
Thank you, doctor. Pneumonia is a very common condition today in elders in India. How do we prevent it?
Pneumonia is a very common condition. People do tend to think pneumonia is nothing but a chest infection. Okay, people do tend to think it happens mostly in the Western countries, and we don't tend to see much here. Of course, the mortality rate is very high because of pneumonia in the Western areas, but it's also common in India. In above 65 years of age, people who definitely have a history of asthma or chronic bronchitis, or even if you're an elderly person, you're more at risk of developing a chest infection, and that is quite common during the months of December and January, because when the temperature is very cold. It usually starts off as a flu, like a plain viral illness, like you get a cold, and then it goes on to your chest and you develop a chest infection or a pneumonia. People do tend to die because of it, only because of late diagnosis, late presentation to the hospital, when the treatment is very simple. It's just antibiotics, either IV or oral, and antipyretics. But early diagnosis is very important. People don't go to hospitals because they think it's just a normal cough that has come, and already their immunity levels are very low in the elderly age group. So when they reach the hospital, their blood count and all will be very high, and they might have to get admitted in ICU and these sort of places, only because they are presenting late. The best thing is to prevent it, and how do you go about it is by taking vaccinations after 65 years of age. WHO recommends, CDC recommends having 2 shots of pneumococcal vaccination, which should be taken within a year apart, and usually it's got an immunity up to 5 years, and then you can repeat the same 2 doses again. So vaccination is very essential, especially for people who have got bronchitis or asthma, or if they have chronic conditions like hepatic, renal, heart diseases.
Thank you, doctor. We have a question. What is shingles exactly, and is it treatable?
Shingles is something that you develop a rash on your body on one particular side, which usually it's because of a virus which is dormant in your body after you might have had your chickenpox or whatever when at a much younger age, and that sort of a virus remains dormant. And then whenever your immunity level goes down, which we see it in the elderly population, and that's the time the shingles comes out. It's basically a rash which comes out in one particular dermatome. We call it as a medical term. So it's sort of either in the back or it is in the front or in your arm or wherever, but it's usually towards one side. Usually the pain that is unbearable, especially in the elderly age group. So we need to, again, you need to see a doctor immediately. Don't think it is just a simple rash, and get it treated with a painkiller. The musculoskeletal painkillers obviously don't work. It has to be treated by a neuropathic painkiller, and they feel a lot better after that. It usually is there for about 2 to 3 weeks and then subsides on its own.
Thank you, doctor. My mom is suffering from osteoporosis for the last 12 years. She is aged 85. How can I help?
Osteoporosis again is a very common condition in the elderly age group, whereby the bone density of the elderly population is very low. More common in women. When they fall down, they get a fracture. So when the bone density goes down, whenever you have a history of a fall, you either have a fracture either of your wrist, your elbow, or your hip, and that could be prevented. You need to have this scan called the Dexa Scan, which identifies whether you're having osteopenia or osteoporosis. And if it is osteoporosis, you can get it treated with a medication called bisphosphonates, either by your family physician or by an ortho specialist. So women who have had their menopause, they are more at risk of having this osteoporosis. I generally advise all women to take a glass of milk in that much earlier age group, because right from the 30 years of age, you start losing your bone density little by little.
Thank you, doctor. Talking about osteoporosis, and which implies calcium intake management, tell us a little bit more about the diet for the elderly today.
What happens when you become older is you have a low metabolic rate. Your activity level goes down. You're not as active as you were before. And even your appetite goes down. You don't feel like eating that you were eating before. Most of the guidelines, or even it is sort of common sense if you look at it, we advise the patients to take nutritious food. It is very, very important. You need to eat plenty of fruits and vegetables, and have whatever quantity of rice or wheat or chapati or roti, whatever it is you can eat. But including a lot of fruits and vegetables into your diet is very important. You might not be, again, taking meat. You might not be able to digest as you did it when you were 50 years of age. So you need to probably reduce the quantity rather than the frequency of it. If you're able to eat it, and if you're able to digest it, it is fine. But there are a lot of people who won't be able to, and they'll come to us and saying that we had this sort of biryani on Sunday, and we had the stomach upset, and it's not, I feel very bloated, that sort of thing. So we'd advise to take nutritious food. It is very, very important. We see many patients who cannot afford fruits. Those are in the sort of low socioeconomic status, and they tend to be lacking on these sort of nutritious food, especially the fruits and vegetables, and their immunity level goes down because of all these things, and go less on sugar, less on oil, less on spices, all these sort of things.
Is there an average calorie intake that you would advise?
The
and women distinctly?
Yeah, the calorie level again depends on your activity. You know, say we see patients of all types. So you might be a 70-year-old, but you might be still doing the job that what you were doing, still going to an office, still looking after your business. So for those sort of people, your calorie requirement will be more. You know, but if there is a patient who's sort of retired, you know, who's just going to take a morning Hindu paper and then just going for a walk and then coming back and relaxing at home and just spending the time with their family, not being as active as he was, then your calorie level will certainly go down. So your body is the best person to tell how much you should take and how much you shouldn't. So for each and every person, it is different. We can't say it's just sort of a general calorie intake for all patients.
Thank you, doctor. We have a question. Tell me about primary treatment for thyroid.
Thyroid is a hormonal problem. It could be now the person hasn't told whether it's an underactive or an overactive thyroid. But time to time, especially in women, we tend to come across underactive thyroid quite common. It is basically because your thyroid gland is not producing hormones, which you should normally, everything should be in a balance, and we tend to see much these days. So, the best thing would be to consult an endocrinologist, find out what type of thyroid problem you have, and have your thyroid function test done. If need be, do an ultrasound neck as well, and go on the proper medication for what condition it is.
Thank you, doctor. We have a question. Is gastric problem common in elderly patients?
Gastric problem, as we've discussed before, it is quite common. Bowel and gastric problem is quite common. As I've told you before, people don't eat that much, you know, the quantity required. They don't feel hungry because their activity level goes down. And the other thing in India is people tend to fast for religious occasions and things. So the acidity, or we call it as GERD, gastroesophageal reflux disease, is quite common. Most common in the adult population, but then it also tends to happen in the elderly age group as well, for which you can consult your family physician or a gastroenterologist, go on the appropriate medication. The other problem with they do develop this GERD is because of the multiple tablets they are on, and most of them tend to be on aspirin as well, which is a stomach irritant, and they might be on painkillers, which might also irritate your stomach. So we most of the time, if you look at their medication list, they'll also be on some sort of a proton pump inhibitor, which tends to improve this gastric problems.
So they need to consult their general physician.
Yes,
and
yes.
Get it rectified.
Yeah, yeah.
Thank you, doctor. My 87-year-old grandfather sees people and animals in his house for the last 6 to 7 weeks. The visions tend to occur more in the evenings once the lights are switched on at home. What can we do? Is he suffering from some specific condition?
This condition is most likely to be some sort of a dementia. As you said rightly, it's an age group that we need to look at. Dementia is quite a common problem in elderly age group. Again, in India, it is so much underdiagnosed. We tend to say, oh, he's grown old, his memory is lost, or he's not able to remember as much as he can. So we tend to neglect, we tend to ignore these sort of problems in the elderly age group. There are different types of dementia. Alzheimer's being very common, which is hereditary. It's in vascular dementia, which develops because of your diabetes and hypertension, and there are other types of dementia like Lewy body and all these things. But the dementia needs to be, when he says he's sort of seeing things and seeing people, first we need to identify, is it a psychiatric problem he's got, or is it a dementia problem that he's got. Dementia people, they tend to forget things, and they don't learn any new things, and they find it very difficult to remember what sort of every day-to-day life, where they've kept what. Okay, so it is very important to rule out dementia, because their day-to-day life becomes a huge problem. You know, like say for example, switching on a stove and forgetting to switch it off could be a disastrous thing. It could be anything for that case. You're probably not well enough to drive a car, and then you forget your whatever. So you need to get it identified by a geriatrician much earlier and go on the appropriate medication. The problem with dementia is it is not the patient himself, it is the carer for the dementia patients. Reason being, you've got to have utmost patience with these dementia patients. They are physically normal, their mobility is good, but mentally they're not in this world. It can go up to the situation where they can't identify their own wife, their own children. So getting diagnosed at a much earlier age, we have a lot of questionnaires. Getting diagnosed by either a family physician or a geriatrician, and go on the appropriate medication to prevent further deterioration is very important.
Thank you, Doctor. Nearing the end of the session, we're still having questions coming in, but would you like to share some advice to our viewers today and a little bit more on the geriatric clinic at the Apollo Heart Center?
Yeah, we are planning to have a one-stop geriatric clinic in Apollo Heart Center here, where myself and Dr. Subhashini will be a part of it. Where we are planning to have a complete list of the geriatric patients and take care of their diabetes, their hypertension, and the coronary artery disease, and their whatever their falls, their social issues, their mental health issues, and everything. We've already started having patients here, and they're very comfortable with our care. Continuation of care is very important for a family physician, and we are planning to promote that particular avenue. For elderly patients, I would advise keep yourself active. It's very important. Go for regular walks, eat nutritious food, spend time with your family and friends, socialize as much as you can, take up new hobbies, reinvent yourself, and be happy, which is what is more important. Thank you
very much, Doctor. Thank you very much, everybody. We'll come back with one more session. Thank you. Thank you.